My name is Tim Ria, host of Informed Health 2015 here at UCSF in San Francisco, and we have Pierre.
Very good, very good. Good French accent.
But good to see you again. So last time I think we were at the Digital Health Summer Summit, and here today you were showing your app again, and love to catch up.
Yeah, so again, we're here with the MS Bioscreen application. So it's an app we've been developing for multiple sclerosis. It's built on the top of the work of 14 PIs from the UCSF neurology group. We've been leading MS research. Over the past 10 years, we've been developing a huge cohort of patients that we've been following over time and accumulating data, imaging, MRIs, genomic, clinical data, treatment, attacks, and environmental exposure. And with my chairman, Dr. Hauser, we decided to go one step further and to unleash access to that data. And that took the form of a tablet application that show one patient trajectory. So typically here, that patient here in blue, we can see how the patient has been doing over the past 10 years. But on the top of that, we can actually pull down the reference distribution of the same metrics, the same information in all the other patients, so that right away we can see how the patient is doing compared to others and use that piece of information to make the right decision and accelerate the path to the right treatment.
What's different about this than what you had out before? And I really love the interface. It really seems very clean and easy to interact with and really see the data.
So we really have, that tool is really a window into the best and the newest reference research data. So we're continuously updating the information so that the patient, the clinician, and the researchers are up to date with the information and the new metrics we are computing. Again, the newest data to make the best decision.
Great. So what is the state now of where you're at and where you're going?
So we're very excited because we published that work in the Annals of Neurology, one of the best neurology journal, and that created a lot of excitement about the tool and this prototype that we've been building. So basically we're going a different direction. We're connecting the app directly to EMR data to enrich the data set, and in order that all the patient, not only the research patient, can benefit from the tool. And it has also attracted a lot of interest from our colleagues that also have great research reference data. And we're now in the process of merging that data into a single reference cohort that will be a reference worldwide.
Wow, that's exciting. So what do you have here now?
So here is the same concept, but pulled to the level of the MRI images. And basically, we give access to the MRI through the Wi-Fi, and we can scroll through the patient's brain, the different area in the brain in 3 dimensions. And we can also move over time to see how a particular slice of brain was doing over time. And again, implementing comparison with other patients. So if you have a lesion in a particular area of the brain, how many other patients do have a lesion in the same region of the brain? And we're hoping to bring more MRI, high quality from research, but large numbers from many other centers in the world.
Wow. Nice job. So how old is this now?
So so we're continuously upgrading not only the front end but also the back end that really make the data available. And this prototype has been running now for a year, and we've been starting to test it at the clinic so that we can get feedback from patients and users about how the data is shown and what could be the most useful.
So Pierre, how do people connect up with you if they'd like to learn more, get the data sets? And to do that, show the whole demo.
So, yeah, I'll show you how we could move slides here and basically spin the brain so that we can really see any angle that we are really interested at. And there's many options where we can see also different type of images. The MRI is very complicated. We have a whole team working on that. Basically have a website, www.msbioscreen.org, and they'll find more information regarding the project and our next steps.
Great. Well, thanks, and good to see you again. Congratulations on pulling that together. It's awesome.
Thank you. Bye.